we're going to be talking about employer-sponsored health insurance, some of the problems with that, and some of the ways that we can maybe solve those problems. So first up, employer-sponsored health insurance is fostering inequality. The most obvious way is that unemployed people don't have access to employer-sponsored health insurance, but it also has ramifications for inequality for part-time or low-wage workers who have less options when it comes to choosing what health insurance they go through their employer, as well as they tend to have worse options of the limited ones that they do have. Not every employee can use employer health insurance because a lot of times it's too expensive, especially for family coverage. And the trend is going in the wrong direction here in America. More jobs are offering part-time, low-wage work, while eligibility for that is declining over time. So that's why we're seeing fewer people with access to insurance through their jobs. There's also taxation inequity. So the way it works is that employer-paid premiums for health insurances are tax exempt. So if you want to buy your own insurance outside of work, you pay with wages that have already been taxed. So it's cheaper to go through employer-sponsored health insurance. But this disproportionately benefits the wealthy because wealthy people have higher marginal tax rates and they usually have more expensive health insurance policies. So these tax exemptions disproportionately benefit them. It's also more expensive. So over time, healthcare costs are rising, of course, which means premiums are going up. But the percentage of employees to employers is unequal. So employees over time are paying greater shares of the premiums while employers have it a little more stagnant. It also encourages higher unnecessary health spending as a result of the tax benefit that we were just talking about. Also, the system we've got right now is really fragmented. It's kind of a mess. You've got all of these disparate groups and these like crazy bureaucracies. It's this really inefficient administration, which is costing us a lot of time and money and effort, just no good all around. Plus, it leads to smaller businesses having less bargaining power. So right now, if a large corporation went up to an insurer and said, we want the best plan for our employees, we want this, that, and the other, and if we don't get it, we're going to leave and we're going to take hundreds of people with us. That's more leverage than a small business would have if they only have 5 employees. There's also a sort of broader issue with employer-sponsored health insurance is that the risk pool is sort of arbitrary. Like the way insurance works is that you want to pool risk so that if one person has to spend a whole bunch of money, they've kind of got a support system. But there's no reason that that support system has to be a company. It could be chosen randomly. It could be through the state. It could be the entire population of America. There's no reason that it has to be employers. And last but not least, employer-sponsored health insurance limits choice. So it fosters job lock. Job lock is where an employee feels forced to remain in a job because they're worried about losing their health insurance. So they're incentivized to stay where they are instead of starting their own business, moving to a better job, reducing their hours, or retiring. You also have what I'm calling the Hobby Lobby problem. So for those of you who don't know, back in 2014, Hobby Lobby removed birth control from their health insurance plans for women. And they took it to court, and it went all the way up to the US Supreme Court, which said, yeah, this company, as a result of their Christian religious beliefs, does not have to offer birth control to their female employees, and it stands that way to this day. So employees who aren't Christian or maybe want birth control have their choice limited as a result of where they're working. And last but not least, you have consumer targeting. The way the system works right now is that employers are the ones bargaining with insurers to choose plans, but their goals may not align. What's best for an employer is not necessarily best for the employee. So we should have a system where the actual users of the health insurance are the ones being targeted, and they're the ones being free to make the best choices for their own health.
All right, so now with regards to the actual COVID-19 pandemic with employer-sponsored healthcare, you can see all of these link up to what Leo has been talking about with just in general employer-sponsored healthcare, but it almost takes it to like a higher and even more difficult level because of this pandemic. There's been great uncertainty with this employer-linked coverage due to a huge fact. So, in March and April of 2020, we know that the economy basically shut down, causing enormous losses in jobs, and with that linked healthcare, obviously. And so, this idea of the churn in the labor market, which is basically the net of the gains and losses of people who are covered with employer sponsored healthcare, has been greatly negative, which I'll actually show you on the next slide. But just talking about this a little more. So overall, I feel like it has been targeting small businesses most of all. And small businesses in general have the worst end of employer-sponsored healthcare just because they are less stable and just starting up. And then with this pandemic, once that hit, they're losing a lot of money. And so these employers themselves are required to cut costs. And it's most of the time, majority of the time, it's not actually going to lead to the cutting costs of healthcare, although it's increasingly becoming so with these smaller businesses because they simply have nowhere else to go at the end of the day once the issues have come about. And so on the next slide, sorry. So on the next slide, you can see the issue that I was talking about with the labor market churn. If you look at the trends from September 2008 to March 2009, it's somewhat negative, but not very much so to actually cause a big issue. And then so for the next bars, you can see it's a slightly positive. And then once it hits that pandemic and the economic shutdown, it's insanely negative. It's negative 3.2. So that's how many people net have lost the employer sponsored health insurance. And then it does become a bit of an increase over May and June of 2020, but that is obviously in comparison to the last bars, not enough to actually get us back to where it was before. So that labor market churn and the loss of employer sponsored healthcare is just insanely outweighing any of the positives. And so another issue is that obviously with the pandemic, people are needing more health insurance because of health issues, and lots of people are actually getting COVID. So they're being hospitalized more and having to pay more, although lots of people are actually losing their jobs, which then they have to pay out of pocket. And that is the issue. And then on the next slide, you can see that there's also a big disparity with minorities during this COVID-19 time with coverage loss. So you can see that white Americans, 11% were uninsured before, and then 12% after the fact. Although for Black Americans, it was a higher percentage before in general, it was 17%, and then that grew to this insane percent of 26 after the pandemic. So just these links to different types of people and where they live, what kind of stability in the job that they have is all linked to this employer sponsored healthcare. And these are the specific difficulties that we do not want. So that is how it relates to COVID-19.
So obviously there are a lot of big problems here with the employee-sponsored health insurance. So let's look at a couple of the possible, proposed solutions, right, that have to do with the government providing insurance in some way. So the pros to like a single-payer public insurance model would be that access to healthcare insurance is not contingent upon someone's job, which has the obvious benefit of during turbulent times that people are not going to lose their health insurance as a result of losing their job. It also means a very high proportion of the population is going to be insured at any time, including the poor, lower class people, unemployed people, part-time workers. They're all not going to have too much of an issue with that. It means that people in these lower classes are more likely to get treated earlier when it's more cost effective and when it's easier to get treated, than thereby avoiding bigger issues later. Often what we see happening is people don't come in to get something taken care of early because it costs more than they can afford. And that turns into an even bigger and more expensive and more dangerous problem down the line. So this could potentially avoid some of those issues. The funds that are going towards the insurance aren't funneled towards shareholders and owners of insurance companies. The money is directed more towards just the actual paying of the insurance. It's, like I mentioned before, more resilient to job market fluctuations and dives, that it won't be quite so turbulent with stuff like a pandemic or a recession that we've had. It also means more freedom to move between jobs without disrupting access to care. So people can move around in the job market, which is necessary for a healthy job market to be there. But what are some of the problems that can come from this? Well, it maintains the fee-for-service delivery model of care, so that incentivizes the volume of care over the value of the care provided. It also means more bureaucratic bulk and government administration, which we already know there's a lot of to begin with. And it's also, that makes it likely to be slow and expensive to operate. It's still vulnerable to lobbying, swaying policy decisions. So even though theoretically it should cut out some of the profit motive at the insurance level, it may or may not see much of that benefit, depending on how hard lobbyists will push to have certain reforms enacted. And then it also upends a lot of the existing systems. So people currently using insurance in a way that works for them might be disrupted by such a big change. And then there could be longer wait times for non-emergency care, as we see in countries like Canada, where they tend to have longer wait times as a result of a system like this. And it also comes with a large price tag, meaning that there has to be major changes in taxation policy. Next slide, please. As for a government-run insurance and delivery of care sort of system, more similar to the UK, basically all of the pros from the previous slide also apply here. And then also problems stemming from profit motives superseding patient well-being at the care level are completely avoided with something like this, because it's not privately owned. But this also has a list of cons with it as well, being that it's not compatible with much of the US system as it stands. It would require like a complete restructuring of everything, essentially, dissolving existing industry, and that puts a lot of a huge amount of jobs in very uncertain places. And it still might not incentivize value of care if fee-for-service is still sort of the underlying payment structure that even within like government-run systems, if that's how they divvy up funding, then that doesn't really solve that problem either. It's even bigger administrative bulk and longer wait times for non-emergency care. And it also has the tendency to devolve into ineffectual micromanagement instead of allowing for a bit more freedom, because the government tends to want to standardize and structure things in a way that may not actually be conducive to better patient outcomes. Next slide, please. So, I mean, are these solutions viable? In theory, they should be. If you were building a system completely from scratch and from the ground up, they seem like they solve a lot of the problems of employee-sponsored healthcare, and that they would work reasonably well. The problems with being able to move around jobs, with job security also being your health insurance security, that's all taken care of, and it would give a great amount of access to insurance at all socioeconomic strata. However, given the US government we have as a starting point, it's debatable for sure. The government's slow to make necessary changes, and it's not very good at making drastic alterations to policy, which would definitely be required in order to enact either of these two sort of solutions. And from one administration to the next, funding and policy could be very unstable. And also the government, not just with healthcare, but in general, is highly centered around the model of regulating private business, and is still susceptible to lobbying. So that will always be a problem when trying to enact any kind of change like this. And also, the greater the change, the less likely it is to make it through Congress intact. So these may seem like a good idea, but also may not be entirely feasible.
All right, now to solving a realistic version of the healthcare problem. It's important to realize the US healthcare system is very complex. Just by looking at kind of the graph on the left, you can see all the different lanes But as far as coverage, we're pretty good. 92% of Americans as of 2018 are insured. For the uninsured or low-income people, low-income people, there are programs like CHIP, and there's also Medicare and Medicaid, which for a long while I didn't understand, so I'll give you a brief rundown. Medicare gives a universal right to health care for people 65 and older. Historically, this range has changed, but mostly based on how many people are actually, over that minimum threshold. Uh, it's a fee-for-service based program that provides hospital insurance and medical insurance, and people can also opt for some form of private insurance under this umbrella. Medicaid is a program that gave states the option to receive federal matching funding for providing healthcare services for low-income families, children, the blind, and people with disabilities. And this was eventually expanded. It includes CHIP, which is a children's health insurance program that started in the late 90s. And as far as public and private spending goes, 45% of total healthcare spending is financed through federal taxes, payroll taxes, and individual premiums. And this is public spending. Private spending accounts for about 34% of healthcare spending, and it covers 76% of Americans, which is crazy high. Hold on to those numbers because we'll bring them up later. Next slide, please. Thank you. I want to type this out in the chat. It's a really cool kind of infographic. I encourage you guys to go check it out that shows how much money is out in the world. So an argument against increasing health coverage is that the middle class will experience a tax increase, which doesn't necessarily have to be true. Just to put into perspective, money, checking out that infographic will be really cool and very representative of how much money is actually out there. Just taking Jeff Bezos, for example, the wealth that he gained was primarily from stocks in Amazon. And so that gain is much larger than his $1.5 million wage that he receives for the year. If an average sales tax were applied just to his wealth increase of those Amazon stocks, that'd be $28 billion, which is absolutely ridiculous if the money were being diverted to the right place. Next slide, please. So I just kind of wanted to show that, the money is there. It just maybe isn't coming from the right places. All right, now kind of the heft. I had to put partially in quotes up there or else this wouldn't really be a realistic system for the United States. But I'm proposing partially regulated and funded private insurance. This wouldn't be a whole new system, but tweaks to our current system for better optimized care and coverages, outlining and addressing basic needs for the whole population. The first step is obviously changing tax law because we need some money for this. I don't know directly how this would work, just that there's money out there that could fund this. The next step would be to create a national health policy that outlines and defines basic needs packages for all. This health policy would regulate private insurance and healthcare, but leaves insurance in the delivery of health services to the private sector. This focuses a little more on changing fundamental requirements of the insurance company rather than taking full control. Practically, I'm not sure if this is an expansion of the Department of Health and Human Services or what, but the idea is there. Once this is done, there needs to be some transition. This would include a transition of funding lanes, using the new tax laws to our advantage to sponsor growth of government departments and that type of idea. This transition would also need to be made to do some in-government optimization based on those numbers we saw earlier, that the private sector is able to optimize so efficiently, cover so many people, and spend relatively less money compared to the public sector. Lastly, somehow this transition would have to ensure some version of satisfaction for the public and those being served. And on top of satisfaction, there needs to be some programs in place to make sure the transition is responsible for the people in the economy in the form of safety. There's a lot to unpack here, and I'm not really sure what this system would look like, but it seems like the most realistic fix based on our current system that I could offer. All right, next slide. And that wraps it up.